This is Dr. David Klein at Stages of Life Medical Institute in Longwood, Florida. Marvelous place to live. Used to live up in the DC area. Great place to leave. What I'm going to talk about here is getting advice. So the question is when is it a good idea to get advice? The best time to get advice is now. Why? Because you have issues going on around you. You've got people that are doing better than you are. You've got people that are doing worse than you are. Getting advice is a good thing because it gives you perspective, other people's perspective. You have one pair of eyes, hopefully. You have a pair of ears, hopefully. And if you use them both, you're going to be able to learn things. Okay? So what do? You ask other people's advice and get their experiences. My dad taught me that everybody can teach you something if you're willing to listen. So it might be something positive, it might be something negative. You can learn from their successes, you can learn from their failures. So asking advice is a good thing. So there's an author by the name of Kiyosaki, okay? Rich Dad, Poor Dad, brilliant guy. So he gave the following advice, which was to find somebody that was very successful in your endeavor and take them out to lunch. You pay for it. You take them out to lunch and ask them what it takes to do what they do and become successful. Because successful people are willing to share advice. They're willing to share their experiences. They give back. You might not believe that to be the case, but it's absolutely the case. The biggest charitable people in the country are the most successful. That is the way of America. That is the way we've done it. So ask advice. Find somebody in your industry that's doing better than you are. And rather than thinking, well, they stole this and they did that and they're unfair here and I'm a better person than they are, ask them, what is it? And why? What is the best lesson that you've learned over the past 20 or 30 or more years to make yourself successful? And you would be shocked at the answers that you get. You would be amazed at what you can learn. So as a successful physician, okay, I ask other people what they've done right and what they've done wrong. If they had to pick something to undo, what would that be? And if they had to make a change in their life, where would it be? Okay? Now, never, okay, are you going to find somebody that's going to say, well, gee, I've made every right decision the entire path. There's a board game that used to be popular when I was a kid. It's called Chutes and Ladders. And most of you are going to remember this. Okay, you can proceed through life and you're going to make a right decision and ascend this magical ladder and get closer to the goal. And then just as quickly, you roll the dice, you'll end up on a chute and you end up at the bottom of the heap. It doesn't take long for this to happen. This epidemic is a great example of that. Some of the biggest businesses in the country are now upside down. That means losing money. Okay? And some of the companies that were not doing all that well are doing famously right now because it hit dead smack in their industry. Chutes and ladders. Next question. Do you ask one person or more than one person? Decisions made by committees are always bad. Okay? Boards of directors are there because you have to have them. Okay, board of directors, that way you can blame bad decisions on them. You never, attribute the best decisions to your board of directors. The CEO, okay, they have a board of directors because either it's mandated by the Securities and Exchange Commission or they do it because the charitable boards insist on it. But you ask opinions, multiple people. What do you think is the right idea? What do you think we need to do? And wouldn't you know it, people don't always agree. So you don't make a decision by committee or you end up like some of the previous administrations with 8-year recessions. It doesn't work well if you do things by committee because not everybody's going to agree and somebody has to be the adult in the room and be willing to take the lightning strike should it hit the wrong spot. So you ask a lot of opinions. Consider them. Then you try to sort through what are the different agendas. And if you don't think this is an issue, I grew up in Washington, D.C., and we had these lobbyists there that went out to talk to our senators and congressmen, state time, state-wise, they do it to the governors and the state reps, okay, to try to influence the decision-making process from their personal financial agenda. That is the way of life. So somebody's going to go up there and throw money, okay, at a state senator or U.S. senator, that's legal. Okay, that is bribery, to be certain, but it's very, very legal. You have to see what their agenda is. It's a marvel to actually take your state representative or your state senator and see where their money came from, and it's all a matter of public record. So they're influenced by the people with the checkbook. So you got to know the agenda. So if somebody comes to you and says, well, Mrs. Jones, you need to buy this annuity. Okay, great idea. Okay, highest fees you can ever imagine and very, very difficult to get out of. It's like having a lifelong timeshare. Okay, but they'll sell these things because that's how they earn their living. You need to find out what their agenda is. What are you getting out of this? And by the way, people are not going to be jumping up and down to work for you without getting paid. So financial advisors, when you pay them by the hour, wouldn't you know it, they tend to actually do a better job. When you pay them by the transaction, they get paid to do more transactions. Churn your account. What a joy. So understand and try to figure out what the agenda is of the individual from whom you are asking advice. Whether it's financial, personal, religious, political, it doesn't make any difference. What do they have? How are they receiving benefit from it? Okay, and sometimes you'll get the right answer, and most of the time you won't. Plan your future based upon what you see, hear, and feel right now. Write things down, okay? Because there's going to be an awful lot of history rewritten, okay? And if you write things down, if you save news clippings, which I don't do because they gather dust, okay, you'll be shocked at how things work out. The history will change week to week. Things that happened 6 weeks ago, wouldn't you know it, people have already rewritten it, and to their agenda, to their political goals. Write things down now. What would you have done differently? Who would you ask advice from to do things better? What can you do to make yourself a whole lot happier, whole, and probably a little bit more comfortable the next time this happens? Here in Florida, we have disasters every year. We call them hurricanes, okay? This is the tornado capital of the world. Why do you suppose that is? For the same reason it's the lightning capital of the world, because we have lots and lots of storms here. If you're familiar with the geography of the state, there's the Atlantic Ocean on one side, Gulf of Mexico on the other, two different temperature bodies of water. We're caught in a whipsaw here. Hit them high, hit them low. So every day we get this, and during certain times of the year, it gets awful. So wouldn't you know it? Okay, here, it's just a Category 3, Homer. Get me a beer, let's watch this one. And that's the way we work here. People prepare for this stuff. So if anybody in D.C. is listening, New York is even better. You know, Superstorm Sandy. We would have yawned through that here in Florida, right? That was just a rainstorm, okay? Ask the Floridians what it takes to make these things work. So, you know, Governor Cuomo, just why don't you ask DeSantis, Governor DeSantis, how do you prepare for a hurricane? It's unlikely it's going to hit New York, but you know the preparedness is exactly the same as it is for any other disaster of this nature, whether it's a storm, okay, or whether it is an epidemic. A lot of the preparation is the same. This is Dr. David Klein, getting prepared for the next one. Have a nice day.